So the history of McClymonds has it's been somewhat problematic for a while. I remember my daughter was in second grade, and I decided to volunteer and be a part of there was an endowment that was created by an anonymous donor of scholarships, and so I was on the McClymonds Scholarship Board, the very first one, volunteering, and walking those halls and saying, I need to get this school ready for my daughter to be able to attend. And so at that particular time, there was, in some ways, a lack of rigor and consistency around who the teaching staff was. There was a big turnover that happened during the late 90s. There was a small schools movement that did not have complete buy-in by community, number one, and then in the places where actually it might have been very successful, I think that the Oakland Unified School District did a horrible job of actually really supporting that school. My great example is Best was going to have a culinary arts school, and the district went forward with tearing down the kitchen that was there and then not rebuilding a kitchen. So how is it that one is going to have a culinary arts school without a kitchen in it? So there's been a very, in that situation, that was facilities department not talking to teaching and learning. And so teaching and learning not being clear about what their academic direction was around the school, and then here was millions of dollars actually being put out on whether we were going to put in a kitchen or not have a kitchen. So, so some of the problems come from a central office, and I think that we are light years ahead now, where there's a conversation that's happening with our Assistant Superintendent Timothy White and David Montes de Oca, who's in quality instruction and looking at curriculum. So I think those are changes that will support a McClymonds going forward. So as we think about the next level of academics and rigor that we can be doing in that school, we're talking about looking at advanced manufacturing as it's linked to STEM. And so that is going to be another one of those examples of, is it going to have the right labs in it? Are we going to have the right kind of equipment in it? Is facilities talking to the academic folks in some real way? So those conversations are actually happening right now, and we're ahead of ourselves in terms of developing that. The other piece that's very specific, I think, to West Oakland is a perception problem. This principal who talked about marketing and PR, right? She needed to be able to lift up a message of, my campus is safe, my campus is welcoming for parents as well as young people to do work here. So we have to be mindful of some of the conditions that are within West Oakland, that Oakland Unified School District has a part and piece in, responsibility in, but we're also talking about what is happening when it comes to development. We're talking about what's happening when it comes to food insecurity issues that exist in that community. And so specifically to what I need to be doing much better, and would use a second term, is to really make some better linkages across sectors. We now have a connection between Oakland Housing Authority and the Oakland Unified School District to share information. So making sure that those collaborations really get lifted up so that, you know, young people are actually in safe housing situations and not struggling around housing, and their families aren't struggling, and so that they're free and less stressful when they get into a school environment. But it goes on to, you know, again, environmental justice issues that happen within West Oakland. We have young people, we have truancy issues and low attendance issues because many of our children are sick. They have respiratory illnesses. We don't have medical facilities that really support them within West Oakland. And so if I could do much better work at pushing actually around the development that happens in that district, I think that that's an important piece to, you know, I have visions of, you know, the state-of-the-art health center, you know, that is actually in West Oakland that deals with young people who have asthma and their parents who have asthma, so that they're getting the best kinds of medications and those types of things. And I think that there's a way in which, as a school board member, I should be able to leverage those relationships and be able to push on those things so that young people are in a healthy and thriving community, and therefore the school can reflect back of that community.
Can I just ask a quick follow-up on that? You talked about kids and children and youth with asthma, or wanting kids to get access to great health care. I mean, McClymonds has a health clinic, or Dr. Burns at Prescott Joseph Center has the breath mobile.
That's right.
What could you do to, as a board member, to better utilize the resources we have?
I can give you an example just on the asthma mobile. It was the first place where they did their launch was Emeryville Annie Yates. Prescott Joseph Center, if you don't know, sits right behind Prescott Elementary School. Excuse me? What's going on? And so it took me having a conversation inside the district around paperwork that was sitting on someone's desk to figure out an MOU. So I think one is it's having really strong relationships with community-based organizations so that I can support them navigate the system, and then after and so that again assumes that you got to do this navigation. You got to can I be in conversation and dialogue with staff and the superintendent to say we have to have a system that responds much quicker to community-based organizations that are able to offer our students and our family services. In terms of working with another bureaucracy like Children's Hospital that sits on our campus at McClymonds, again, another opportunity to elevate the conversation and do greater advocacy, because again, I think there are times when the wonderful people who work inside of our institutions are not always communicating very clearly. So McClymonds is a space that was actually promised where it was literally where it's physically built. It was supposed to be able to open out into community so that there's a back door so that people could actually access that. But it takes conversations at a superintendency level with a Children's Hospital level. And over the 6 years and when it was birthed, that was during the time when we were under state receivership. So those conversations didn't necessarily happen, did not rise to the top as priorities.